Costs are shifting to employees. Democrats are challenging Republicans, and PBMs are back in the news. Welcome to In Case You Missed It. First up, employers are preparing for another tough year of healthcare costs. So, according to Mercer, 66% of large employers are likely or very likely to shift more of these new costs onto employees in the form of either higher per paycheck deductions or higher deductibles out of pocket costs. In plain English, employees may keep the same insurance card, but the plan may feel a little more expensive when you try to use it or when it comes out of your paychecks. And this is kind of where the conversation gets a little uncomfortable because employers don't want to do this. They're trying to balance the budget. They're trying to keep this into control. You might be paying $100, $150 more per paycheck. They're paying 60,000, 70,000 more per month. So this distinction about it hurting the paycheck is a major pressure point for employer-sponsored healthcare. The employer is trying to protect the budget, the employer is trying to protect the household, and the healthcare system just keeps sending both of them bigger bills. Next up, Tennessee passed a law aimed at separating PBMs, pharmacy benefit managers, from the pharmacies they own. Express Scripts and the PBM trade group are now suing to block it. So this matters because PBM sits directly in the middle of the prescription drug system, which is the biggest problem within the biggest problem. They help manage the formularies, negotiate the rebates, process the claims, and influence where people get their prescriptions filled. The debate is over the vertical integration of this. On one hand, putting related services under one roof can create efficiency. That is the argument from the PBM side. On the other hand, when the company helping manage the drug benefit also owns the pharmacy, states are asking the fair question, which is this lowering costs or just giving one company more control over the system? This is why this lawsuit matters, because it's not just a Tennessee story. This is just where the story started. It's part of a much bigger national debate over whether healthcare consolidation is helping patients or simply making the system harder to understand and harder to compete in. And finally, Democrats are trying to force a vote on a Trump administration ACA rule they say could make coverage harder to enroll in and more expensive to keep. So the administration is saying this rule is designed to reduce fraud and improve program integrity. Democrats argue it's going to make it harder for people to verify they are eligible, which means more people will lose coverage. Here's the balanced version. Fraud matters, yes. Verification matters, yes. But access matters too. If the process becomes too complicated, some eligible people will lose coverage. Not because they're gaming the system, because paperwork, deadlines, documentation can become barriers. So the real policy question is not simple as fraud prevention versus coverage protection. Better question is, can we reduce abuse in the system without making health insurance harder for the people who legitimately need it? That is the center of the tension of this debate. So this week's theme is pretty clear. Healthcare costs are rising. Everyone is trying their best to manage the pressure. Employers are shifting costs to employees. States are pushing back on PBMs. Democrats are forcing ACA rules to be upheld and forcing the Trump administration to stand up for them. Different stories, same underlying issue. The healthcare system keeps getting more expensive, more consolidated, and more complicated. And when this happens, the people at the bottom of the chain usually feel it first. So that's your In Case You Missed It. Healthcare is complicated. We try to make it not so.